Into the morning blend. We're talking with Dr. Hagarty this morning. If you are looking to maybe improve your skin, maybe some signs of aging you want to address, she's definitely going to be the best person for you to talk to. Thank you so much for being here with us this morning.
Thanks for having me.
So say I may be looking to improve my skin, whatever that looks like. Maybe I have some wrinkles, some lines, maybe some dullness. That is kind of your area of specialty, is helping people feel the best about themselves and achieve the goals that they want with their aesthetics.
Yeah, I think, starting with the basics, making sure you're well hydrated, you get a good sleep, you're eating well, those are really important. And then, of course, we have a lot of little things we can do to help augment that.
Yeah.
Obviously, there's Botox, there's fillers. Fun things are, peels or microneedling. All of these things can help contribute to a really fresh look for your face.
Absolutely. And they're all really minimally invasive, would you say? Mm-hmm. So when people come in and they're a little nervous maybe to start talking about these minimally invasive things, what's your best advice when you're starting with somebody new?
I think, it's really important to ask questions, get a good feel for that trust relationship. Ask them to tell you what to expect in that process. If you're really anxious, sometimes with patients like that, we'll just do a little deep breathing first. We'll count breaths. It's very simple. It doesn't have to be scary.
Okay. I think you have a very calming presence too. I was like, I'm just gonna say it now because we're talking.
Thank you.
And I think that's really important when you're working with someone, because it's really vulnerable to talk about all these things, especially if maybe you've had skin condition or maybe some acne scarring from your youth. You can help kind of address those things with folks.
Yeah.
So, a couple of the procedures we talked about were those lifts, or not lifts, excuse me, those peels and some of those things. What is a liquid facelift? Would that kind of fall into that category, or would it fall more into the injectable, minimally invasive category?
So more injectable, minimally invasive. It's actually really fun. When I think back, I've been in practice for 20 years actually. And 20 years ago, we didn't have any of these options. All we had was something called bovine collagen to inject, and it burnt, it hurt a lot, and it didn't last very long. Now we have a whole host of fillers. Most of them have a little bit of numbing medicine mixed in, so you may feel a little bit of the needle initially on the surface, but the rest of it is pretty comfortable.
Oh, wow.
A liquid facelift combines filler, bringing some support back to the face, maybe the jawline, maybe the cheekbones are a little bit flat. And then also, one of my favorite things is called the thread lift. So again, it's just needles, it's a bit of numbing, but it's essentially lining a suture underneath your skin, and it pulls back on what's called the reticular bands that are the support system for your skin. And it kind of pulls them like Velcro.
Oh,
and you trim off the ends.
Yeah. So you're going from probably a little bit maybe a sag to then just a very minimal. It's not what I think people typically think of a lift, where it's really tight and kind of visibly done. This sounds incredibly natural.
Yeah, and it's nice because it's not overdone, as you said. You don't have a lot of bruising necessarily. It takes about 40 minutes. It's in the office. You don't have to go to sleep or take any medication. You can kind of walk out a brand new you.
That's amazing. It's incredible to see how much this type of medicine has transitioned. How can you achieve these kind of surgical looks really naturally? And it sounds like it's relatively easy.
Yeah, I mean, a lot of it we owe to technology and biotech development, but also just having that principle of understanding what a person looked like originally, what the proportions of the face are, trying to augment the support in the right directions without making it look weird.
Yeah, I feel like that can be a challenge for some women too, because your face does change over time with age. And is it challenging to kind of recreate your face at a period of time, or just transition a little bit? I bet that's something a lot of people ask about.
Yeah, I think it really comes down to the training of the person that's doing these procedures. You have to understand the bone structure, the muscle, you have to know where the arteries and the nerves are. You want to always be safe. But as far as natural goes, you should just understand that you're trying to recreate the normal structure and support that you had that maybe just got a little bit loose.
Okay, so that is a good way to approach it, is not maybe showing a picture of somebody else, but showing a picture of maybe you from 10, 20 years ago that you said, I liked how full my skin was at that point. How can we achieve that? And it might not necessarily be an injectable, could be what you mentioned, those kind of more at-home treatments, taking care of your skin. But I'm curious if hormone replacement therapy would fit in there, because a lot of this does happen post-menopause.
Correct, and that brings me to a topic that's near and dear to mine and many middle-aged women's hearts. our skin changes a lot with hormone changes. So before you think of any of the other things that plastic surgeons can do, it's really good to have a good relationship with your primary care, your gynecologist, or somebody who's trained in menopause therapy to help you transition. You know, things happen when your hormones go away that are hard to reverse if you leave it too long. So it's really important to get in there right when changes are happening. You know, bone structure, muscle mass, energy, sleep, again.
It's like, I was like, you are speaking to a lot of women right now.
Yeah.
The lack of sleep can be really difficult.
And that takes its toll. So if that's not treated, oftentimes women will bring that up to me, and I'll talk to them about who they're seeing and where they could go for help for that. Luckily in our office we have Dr. Joe Ekberg, who does bioidentical hormone therapy for women and for men. So that's a great resource as well. But as long as you have someone who's well trained, you know, certified in menopause therapy, it's very useful.
It's really a holistic approach to somebody's aesthetics, that you're really going back to the base of what causes all these things, you know, how you're taking care of yourself, changes within your body and your hormones. I love that you do this approach with your patients.
Well, we're supposed to, you know, help people.
Yeah.
Doctors.
I was like, and you're definitely helping a lot of people.
We try.
Thank you so much for being here with us. We appreciate your time. And we can't talk about everything I would want to ask her about right now, and I'm sure you watching at home as well. So you can give Dr. Hagarty a call and get appointments